Welcome back to Chatter, everyone. I'm Tim Stenovec. Beyond physical symptoms and sickness, the coronavirus pandemic can have an impact on mental health as well. Some are worried about illness of their economic security, but that can actually be a healthy response. Joining us now is Dr. Ziv Cohen, clinical and forensic psychiatrist. Dr. Cohen, thank you so much for taking the time this morning. Give us an idea of what you've been seeing overall from your clients over the last week.
Well, I think we're seeing a big range of symptoms and behaviors. On the one hand, we're seeing individuals who already have an anxiety disorder like OCD or generalized anxiety disorder, and their symptoms are on the whole getting much worse. People are having panic attacks, people are needing to make sure that they are taking their medication or even having to increase the dosage of their medication. But then we also have people in my practice, for example, who don't have an anxiety disorder. They may have other psychological issues that they're trying to work through. But now they're seeing an uptick in their anxiety, and we're spending a lot of time working that through and talking about what is a healthy response to this kind of situation.
Well, let's talk about that healthy response. You sent us ahead of time some strategies of dealing with stress during unprecedented times, such as these. Give us an idea of what people can do when they start to feel overwhelmed, when they start to feel anxious.
Well, I think there's a few different strategies that can be employed. First is that it's important to not overconsume media. The media is extremely important here. Everyone needs to stay informed. But, if you're glued to the media constantly, then that is going to cause a lot of obsessional thoughts in your mind and could amplify your worries and your anxieties. So that can be a problem. In addition, it's really important to do the things that are important for self-care. So if you're able to get out, with social distancing, of course, but do some exercise. It's very well shown that exercise improves mood, reduces anxiety, improves concentration, improves your overall sense of well-being. It's also important to engage in hobbies or the kinds of things that normally make you relax. When you're engaged in a hobby, concentration tends to come effortlessly. You focus, you're not thinking about external distractions, and that's very positive for a sense of rejuvenation. It's a really good chance to connect with friends and colleagues that you haven't been in touch with. I think that a lot of people are finding it's very welcome when you get that call from someone you haven't talked to in a while who just wants to check in. And I think both parties feel uh, rejuvenated by that and strengthened and like they're, not alone in this. So those are some of the strategies that can be very helpful.
Now, I know a lot of your clients come from finance backgrounds and work on Wall Street. To what extent are you actually able to give us an idea of what they're going through right now and how they're dealing with the stress?
I think that, individuals really are professionals, and this is the job. It's to this is what they're paid to do, which is try to manage financial risk, especially at times like this. But it's certainly a tremendous stressor for them, and they're following the markets, they're working 24/7. And so what we're trying to do is really prevent burnout, because burnout is something that could easily happen here. This is a situation that has no clear end date. And so, again, some of the techniques we talked about a moment ago in terms of self care are really important for those individuals. And of course, there's a lot of economic insecurity. Stock values have gone down, net worths have gone down. And so that's putting a lot of pressure on people who work in the financial sector.
Dr. Cohen, I know that one thing people are getting used to in this new normal as we see it right now is working in a different way. And part of that includes childcare and maybe two partners that work, but also have to take care of kids because school's out and childcare options have essentially dried up in many parts of the country. What are some ways that people can communicate in a healthy way with their partners to make sure that everybody's on the same page and getting through this together?
I think that it's important to try to make sure that you're spending time with your partner. Now, for some people, this is not a problem. Everyone's at home constantly. But for other people, for example, healthcare professionals who are going out and they are on the front lines, it can be very difficult to just have normal communication with your partner. So I think the first thing is to make the time and the space to be together, to review the day, to talk about what are the stress points. One technique I like to use is to say, what were the two most stressful things for you today? Because I think if you ask someone that question, you're very going to quickly going to get to the heart of the matter in terms of what's challenging for them, and then to discuss together how to address that. I think that with the children, it's certainly challenging. The children have a lot of energy. We understand that they're going to spend some time on the computer doing remote learning, and there's probably going to be more TV than usual. But I think thinking creatively about how to occupy them, whether it's with arts and crafts or other activities, and sharing the burden between partners can be really helpful.
A big thank you, Dr. Ziv Cohen, clinical and forensic psychiatrist. Thanks so much for taking the time today. We appreciate it.